Members, we have already formed a quorum and it's the appointed time. Let's get started. First item, information papers issued since the last meeting, nil. Item 2, items for discussion at the next meeting. The list of outstanding items for the discussion and also list of follow-up actions have been circulated to members. Let's invite the administration team to join us so we can discuss together what we're going to discuss at our next meeting. The next meeting will be held on December the 16th, a Monday, at 4:30, again at this conference room. The administration has proposed the following items. Last time, Dr. Fernando Cheung would like to discuss the issue of dental care policy and services for the elderly and people with disabilities. He'd like to advance the discussion of the item so that before the announcement of the policy address, we'd like to strive to have the relevant policy in place as well as the funding for the implementation of these initiatives. And earlier on, we decided that we should discuss the resources allocation among hospital clusters by the hospital authority, as well as regulation of pesticide residues in Chinese herbal medicines. Those are for the December meeting. But then the administration has now come back and it'd like to discuss dental care policy and services for the elderly and people with disabilities, as well as the issue of regulation of pesticide residues in Chinese herbal medicine, while resources allocation among hospital clusters by the HA will be deferred until January. What's members' view on this? So next time, they will discuss with us regulation of pesticide residues in Chinese herbal medicines. Yes, Mr. Peter Cheung. Chairman, just now you said that Dr. Fernando Cheung proposed dental care policy and services for the elderly and people with disabilities, and the administration is also asking to discuss dental care policy. Are the two the same? Well, last time Dr. Fernando Cheung would like to discuss the issue early, that's about dental care policy and services for the elderly and people with disabilities, and originally we have scheduled that for the first quarter of next year, and he'd like to have an early discussion on that, and now it's being proposed to be discussed in December. So originally for our December meeting we had two items, that is regulation of pesticide residues in Chinese herbal medicines and also resources allocation amongst hospital clusters by the HA, and now the administration is proposing to postpone the HA issue to January. So any comment on that? So following the suggestion by the administration, we'll discuss the two items, dental care policy for the elderly and PWDs, and also regulation of pesticide residues in Chinese herbal medicines. And then the January meeting will be held after the announcement of the PA. The normal practice is that after the PA is announced, then we will have to have a briefing by the Bureau Director on healthcare policy relating to the PA, and the meeting will be extended. So let's see how things go next time in December, and then we'll decide what items to be included in our January meeting. Item 3, we have two items for discussion today. I'm sure many members will be concerned about this. First, regulation of pharmaceutical products in Hong Kong, and the administration's information paper as well as the background paper prepared by the Secretariat have been circulated by members. All members of the Council have been invited to join the discussion on this item. First of all, over to you, Bureau Director. Can you walk us through the paper? Yes, thank you, Chairman. We propose that there will be legislative proposals to enhance the regulation of pharmaceutical products in Hong Kong by amending the PPO, the Pharmacy and Poisons Ordinance, and its subsidiary legislation. Because we have to implement the recommendations by the Review Committee on the regulation of pharmaceutical products in Hong Kong, hereinafter called the Review Committee, because some of these recommendations can only be implemented after the amendment of the existing legislation. and for legislative proposals, they've been set out in the discussion paper submitted to this panel. Well, the background to this is that in early 2009, we had a spate of incidents involving pharmaceutical products, and that's why in March 2009, a review committee was set up to comprehensively review the pharmaceutical products regulatory regime. And after a detailed study, the review committee is of the view that the existing mechanism and framework can continue with some fine-tuning and enhancement, in particular concerning the manufacturing, the distribution, the sale of these pharmaceutical products. They should be subject to enhanced control and regulation. In 2009, December, a report was published. A total of 75 recommendations were made by the review committee, and in para 13, we have set out those 75 recommendations under 7 broad categories. As the review committee's recommendations involve different categories and depth, and also some of these recommendations might also affect the relevant sectors, and the implications might be far-reaching. In order to expeditiously implement some of these recommendations, a couple of years ago, for recommendations that do not require extra resources, we have been implementing them in stages. Amongst them, the relevant departments and institutions have already implemented a total of 59 recommendations without the need to amend the relevant legislation, and the progress has also been summarized in Annex B to the paper. And then for the remaining 16 recommendations, they require amendments to the existing PPO and the subsidiary legislation. And in order to assess the impacts of the proposed legislative amendments to the pharmaceutical dealers and so on, the administration commissioned a consultant to conduct a regulatory impact assessment, and having considered the RIA result and views expressed by the relevant stakeholders after extensive consultation, the administration has decided to propose legislative amendments to the PPO and the subsidiary legislation to implement most of the recommendations, which are conducive to enhancing the regulatory regime without causing significant impact to the relevant parties. And only, we can cite this example, which has not been adopted in this round of legislative amendment, and that involves the sale of registered pharmaceutical products, and for the sales outlets, they have to be registered. And under the PPO, such products can be categorized into 3 categories. We have Schedule 1 and Schedule 2, and of course there are different level of regulation, and there are also this Category 3. They are non-poisons. So what are they? For example, vitamins and also paracetamol. They are relatively simple, and in most circumstances the complications or side effects would not be very serious, and we do not rule the possibility that a minority of those stores which have been selling such products which have nothing to do with what I refer to as Schedule 1 and Schedule 2 products, despite the fact that these are non-poisons, they've been registered with the DFH already, and yet for those outlets only selling such, they would also be required to be licensed. And we do not think that that would be necessary, and the implications would also be rather far-reaching. That's why for this particular recommendation, we have not accepted that. Other than that, most of the recommendations, out of the 16 recommendations, have been included in this round of legislative amendments. And of course, for the 16 recommendations and their details, in the paper, in Annex A, we have already set out the details. And we have also taken the opportunity to clarify and update the relevant provisions in the relevant legislation in order to make the definitions clearer. And I'll highlight some of the salient points here. First, with regard to the regulatory regime, we look at the sector, and also there are two broad categories. Number one, the outlets, and also the pharmaceutical products, and we will also be enhancing our regulation on manufacturers, wholesalers, and exporters, importers, wholesalers, and retailers, so that for registered pharmacists, the relevant code of practice would also be issued to them. And also, as far as the manufacturers are concerned, we propose that we will introduce the ASP system, the authorized sales persons or sellers of persons, and they will have to be responsible for the quality of the products that are being sold. In other words, they will have to have an authorized person, and that must be a pharmacist with specified experience. We hope that through this we'll be able to enhance the manufacturer's record requirements. So the processing would also be subject to more stringent regulation. And then for non-poisons sellers, they would also be subject to a licensing system. In other words, even if they are non-poisons, number one, the drug itself will have to be registered, and second, the wholesalers would also have to be regulated. And for importers and exporters, registration mechanism, and also for wholesale poisons licenses, they will be merged into one. So they will be streamlined, and they will also be unified, so that all licensees will be subject to one set of regulations. And then at the retail level, there will be stepped up requirements on the storage of pharmaceutical products, and also for drug sellers, at all times of the operating hours, there must be a registered pharmacist present. That would represent a change, because at present, for the authorized sellers of poisons, only part of the time would require a pharmacist to be present. And of course, at present, even without the presence of the pharmacist, as for the prescription drugs, they cannot be sold in the absence of the pharmacist. But now will require a pharmacist to be present at all times.
But after considering the number of registered pharmacists, the given number of these people, we would allow for some time before this will take effect. Regarding the regulation of pharmaceuticals, we would like to comply with the EU, and we will define the terms such that the relevant terms and international practice can be uniform. We also suggest amending the labeling such that the monitoring can be more effective. In addition, in order to enhance the efficiency of monitoring of drugs, we would also like to propose a negative vetting to deal with the registration of pharmaceuticals and poisons. You would be aware that in the Legislative Council, you would see that every once in a while I need to put forward a motion regarding new registered pharmaceuticals, because when these pharmaceutical products are registered, if the authority feels that the toxicity or side effects, they might require stricter monitoring, and it would have to be included in a special schedule. It would have to be dealt with by way of subsidiary legislation. The industry and the medical industry feels that because of this procedure, we need to set aside dates. Of course, not just during this time. The Department of Health, they need time to deal with this. So the legislative procedure, if we were wait till the legislative procedure to conclude, first of all, the industry, the drugs will be introduced at a later stage, and if you consider the patient's needs, the patients will have the drug at a later date. So when I make these submissions, to be included into subsidiary legislation. These are drugs for serious diseases such as cancer. So the proposed legislative amendment is between paragraph 16 and 30. So the review committee is headed by the Department of Health. So the review committee has considered the industry views, and the regulatory impact assessment has also been conducted amongst stakeholders. So the public and stakeholders are in consensus of strengthening control such that the pharmaceutical industry can be safer in Hong Kong. I'd also like to mention some examples where there are differing views. For example, we've heard views regarding doctors in clinics when they place orders with pharmaceutical companies. First of all, it can be done over the phone right now. They can place an order over the phone, but when the drug is delivered to the clinic, the doctor needs to sign off on the delivery. But under the new regulations, when the doctor places orders with these suppliers, there needs to be a written purchase order. So some of the industry, just part of the industry, feel that that is less efficient, and this requirement does not necessarily enhance safety, but that's a differing view. We also have a lot of support for this new measure. So the mainstream feels that there is support for this measure. So in the first quarter of 2014, we will propose this legislative amendment. Well, this is somewhat complex. We have 4 members with questions. Just now, the Secretary said talked about the manpower problem. I read the newspapers. There are some 2,000 registered pharmacists, and if pharmacies need to have these people present, then there's a shortfall. And we also heard that there would be negative vetting. So does the government have any arrangement for supply of manpower, and do they have any forecasts? The second question is, as mentioned just now, the review committee looked at the non-poison pharmacies, but then the government said there was a large impact and there would have to be further review. So if they are not registered, does the government have any inspection arrangements? Because the public would like to know the outcome or information. So where can we get hold of this information? Even though they're not selling poisons, but they are still pharmacies. So does the government have inspection arrangements? Well, first of all, regarding inspection, I'll defer to my colleague. Regarding manpower, the number of pharmacists come from 2 sources: locally trained pharmacists and pharmacists graduating from overseas who have passed a local testing and registered in Hong Kong. Regarding manpower, in Food and Health Bureau, there has been a steering committee reviewing the manpower in the medical industry in Hong Kong, of course we look at the supply, training, professional qualifications monitoring. So this committee, they would have to wait till next year before they examine the issue of pharmacists, but there is an ongoing review regarding the retail outlets of non-poisons. Do we inspect these? How do we ensure our safety? I'll defer to Ms. Thank you, Chairman. In Hong Kong, all drugs sold in Hong Kong have to be registered. So whether it's poison, non-poison, they have to be registered with the Pharmacy and Poison Board before it can be sold in Hong Kong. So the majority of pharmacies belong to Part 1, Part 2. Non-poisons are fewer in number, and their side effects are less. Currently, the regime requires Part 1, Part 2 poison products have to be sold in registered retail outlets. So under the legislation, under the amended legislation, as the Secretary said, all wholesalers, including retailers of non-poisons, they will be regulated under the same ordinance, and they would be monitored by the same standards, and the records have to be uniform. Their shipment of drugs, their retailing of the drugs locations, all this will be recorded. So under the new amendment, the wholesalers will have to accept the registration process and have to be inspected. Regarding retailers of non-poisons, we feel that is not the majority. The majority of pharmacies have registration for Part 1, Part 2 poisons. So these locations will also be checked. Next, Wang Dinggong. The authorities are reviewing the pharmacies, pharmaceutical products, and will amend the law. I think that will have a positive impact on public safety and the production. So the DAB supports this. We also see in the information that currently Hong Kong adopts the GMP 1995 WHO standards, but in 2007 WHO had already upgraded the standard. So we feel Hong Kong is lagging behind. So I want to ask, do we have any mechanism regarding manufacturing requirements of pharmaceuticals? Do we have any mechanism to enhance the standards in a timely manner to comply with international standards? And in order to implement these suggestions to enhance the regulatory regime, so I think the Department of Health and will have to increase its establishment significantly. And according to the document, they will double the manpower. So I'd like to ask the Secretary, are you prepared for your recurrent expenditure? And how is the recruitment of establishment proceeding? Will it be done in phases, or could you provide us more details? Thank you, Chairman. First of all, in manufacturing standards, according to the review committee's suggestions, the GMP standards will be enhanced by 2015 to meet the international requirements, the PICS standards. So this international agency has members from different jurisdictions, and they will strengthen communication between the different jurisdictions. So after consideration, we feel that enhancing to this level is necessary. So if you're referring to future, when these international standards continue to enhance, how will Hong Kong react? Well, in principle, we have a mechanism to move along with the times. So when we have new and better standards, we will adopt them. But a lot of times in adopting these standards, we need to understand we need time for the industry to adapt. So we can implement these without significant impact, because we want a stable supply. So we will review these standards every now and then and take the necessary steps to enhance. So the second question, am I allowed time to respond? If I can, then my colleague can respond. Mr. Chair, in order to follow up the review processes, we have already set up a drug office in the Department of Health, and staff deployment will be provided to enhance the licensing and inspection work. So you do not need to come to LegCo for extra resources. We already have the resources. We have the resources.
No wonder you feel so assured. Next, Mr. Vincent Fang. Thank you, Chairman. With regard to the manufacturers, earlier on there were problems. I think it's indisputable that the administration should step up regulation of manufacturers. But then the implications would be rather far-reaching in my view. In particular, if you look at the manufacturers, wholesalers, and also retailers, well, everybody in the chain will be affected. I've also heard many from the sector, even pharmacists. I've met many of them, and they've told me that they believe that they will encounter tremendous difficulties in their work, because in the past, all they need to do is to place a phone order, but then now they will be required to fill in the form and send in emails and so on. So it's rather cumbersome. So many sectors will be subject to regulations, and they have voiced many concerns. So, Chairman, if possible, can I suggest that either this panel should hold a public hearing so that stakeholders from the various sectors can be invited to come and tell us how they feel about the enhanced regulatory regime. To what extent will they be affected? As I told you, pharmacists will be required to be stationed at the ASP, and for larger pharmacies is of course not a problem, but then for the SMEs it's going to be a big problem, because right now they hire part-time pharmacists so that while the pharmacists are present, then they will be able to dispense prescription drugs, and then after they have left, all they need to do is to lock the dispensary. And then how about the manpower of pharmacists? You haven't been able to meet the demand, and now you are going for legislation first, and then by the time when manpower is adequate, and then you will implement the measure. I don't think that's the right approach. Why can't we do it the other way around? Why don't you first provide the necessary manpower before you implement the measure? And then we have also had a lot of painful experience in the past when the administration introduced this negative vetting procedure. So please do not go along that route again. Bureau Director, any response? Yes, indeed, Chairman. First of all, on the implications for the trade. As I said at the beginning, well, actually, this happened in 2009, and the review committee already published its report in 2009, and during the past few years, precisely, the administration has been working and consulting the stakeholders, and most of them have already had very sufficient communication with the administration. As I said, overwhelming majority of the sector are supportive of these measures. And for those who might have had different opinions or who might have been affected would be those who would be required to place their order in writing. We understand that there are Western doctors groups which are against it, and there is one Western doctor or medical practitioners group and one pharmaceutical sector group that are in favor. But then we have had a lot of discussion already, and a lot of preparation has been made. And I also have to point out that as far as doctors are concerned, according to what we gather during the consultation process, overwhelming majority of the doctors, including the Medical Association, they are in favor. In fact, they have even pointed out that for the Medical Association, under their GMP good prescription guideline, they are also suggesting that doctors should be placing orders in writing. And also the Medical Council even pointed out that for registered medical practitioners, they should follow the Medical Association's good prescription guideline, and therefore there is no compromise to make. I've also been a private practitioner, and I am fully aware of the implications. I do not think that the implications are so extensive that we should not accept this very good recommendation. And secondly, on the requirement for the pharmacist to be present, and as a result, the opening hours will have to be extended. Well, as we said, we don't have to implement it right away. We'll be looking at the situation by the time when we feel that there is already adequate manpower of pharmacists, and then it will be implemented. And therefore, well, I personally do not think that there is a need for us to hold a public hearing. And of course, it's for the panel to decide. And then for the negative vetting approach, is not going to save the time of the executive branch. And it is not a political issue. It is just about the registration of a new poison or a new pharmaceutical product, and it's been vetted by the PPB. And after it's been vetted, and it is of the view that in terms of safety, efficacy, and everything, this is a pharmaceutical product that should be registered so that the doctors will be able to prescribe and administer it on the patients. And of course, it is the individual decision of the medical practitioners. And if it's not registered, then the doctors will only be able to use it under one situation, and that is where there is sufficient evidence. And usually when the patient is in a very critical or acute situation, and then he will have to apply and declare with the DFH before he can use it. And I'm sure even for the pharmaceutical manufacturers will be in favor of it. That's why I urge Mr. Vincent Fang to give it a second thought. All right. Next, Mr. Peter Chang. Thank you, Chairman. Just now, Mr. Vincent Fang proposed that a public hearing be held. I also share his view. And of course, the Bureau Director also said that the views were already very clear. Number one, those are the views dating back to 2008 and 2009, and 4 years have elapsed, and therefore the views might have changed. And to me, as a layman, I'd like to listen to both camps of the view, or two sides of the view. As the Bureau Director said, all right, placing order in writing and also placing order by phone. And of course, I'll be in support of placing orders in writing. But then there are bound to be people who might have difficulties placing orders in writing. So would that pose a lot of difficulties for the business? So I think it's always better to listen to more views. That's why I'll tend to support Mr. Vincent Fang's suggestion that a public hearing be held. And secondly, it's about enhancing the regulatory regime for pharmaceutical products. I agree. That is, we should move towards the better. But then, as to what extent should the administration be controlling the situation? And of course, the administration will have to follow up on these. But then, in many cases, well, it's not the problem with the product itself. For example, today I've been interviewed by a reporter asking me, do I have any idea as to what's meant by this sea mushroom? And according to some press reports, is a banned substance in overseas jurisdictions, is treated as a poison. But then in Hong Kong, there is no regulation whatsoever on this type of substance. So for similar situations, if this medicine company is introducing this into Hong Kong, all right, there is no control whatsoever, and naturally they can sell it. But then in regulating this substance, if the administration takes a long time to regulate it, then for the drugstore involved, it might be affected. I'm citing this as an example. I'm sure there would be this mutual notification system in place between different governments, and when an overseas jurisdiction or government takes a decision on a certain substance that it should be banned, so how long does it take for us to align ourselves with them? And during that window period, will that affect our drugstores or dispensaries? Well, it might not have anything to do with your proposed legislation. But then, after they have introduced the drugs into Hong Kong, they might be incurring a lot of losses if subsequently the drug is banned. So, Bureau Director, can you share your views with us? Mr. Jiang, first of all, I'd like to point out, well, just now you had the impression that since 2008 and 2009, the consultation might have elapsed and it might already be outdated. I'd like to say that for the consultation exercise, it only completed this year, so it's very updated. Second, on the impact on the business environment, well, in fact, we've been very cautious and prudent about the recommendations of the report. That's why we have taken 2 or 3 years to conduct the consultation, and some of the proposals would be implemented earlier. And then for the rest, we allow the trade to have more time to digest them. In fact, in terms of the business impact assessment, we have already done a lot of consultation. We would consider that comprehensively. We would not be considering one side of it, of the view. And of course, patient care is the most important thing, in particular when you talk about psychotropic substances which might be addictive. This is a very serious matter. So even if they want to go through our mechanism, it might be too long, and that's why there is every reason for you to support our proposed mechanism in order to guarantee patient safety, in particular for proprietary medicine which could be addictive. Then even if there is medicinal use, then they would have to be included in the poisons list, and they will also have to be registered under Schedule 1 and Schedule 2. And even with doctor's prescription, there would also have to be a pharmacist's presence, and also the buyer's particulars, including his name, ID card, and address, will have to be registered. So, Mr. Chiang, from the perspective of patient safety, you should have given us strong support for this initiative. All right, my colleague has managed to identify that mushroom is really a mushroom, but then it might have to do with another panel, the FEH panel, not this one. Well, Bureau Director, for the order, for the placing of order, well, it can be done electronically or by fax, so it has to be in writing, right? Yes. So colleagues might be concerned about the record-keeping requirement. So for the record-keeping requirement, that might be more problematic. I think record-keeping is important because whenever there is an incident, we have to be able to track that down. Because when the products reach the clinics, on the receipt of the drugs, they will have to sign on a particular paper, and the amount might be somewhat different from the amount being ordered. So that would only show that this mechanism is necessary. So which documentation is more important, the receipt or the order? Chairman, let me explain. Because under our mechanism, it's not just to guarantee patient safety, it's also intended to crack down on unauthorized sale of poisons and also unauthorized resale of such products. That's why this record-keeping requirement is even more important. Can you explain a bit further how this is going to be done? All right. In the event, all right, let's say I've ordered 100 boxes, but then when they arrive, they only deliver 50 boxes. No, we are concerned about the contrary. All right, you might be placing 50 boxes. What if they deliver 100 boxes? So for the remaining 50 boxes, there will be no trace at all. So for the delivery of 100 boxes, that would be the doctor will have to sign on the receipt, and then you'll be able to track down on that. So 100 boxes have been delivered to the doctor. All right, originally there's a loophole. Then at least you'll be able to trace back to how many boxes you've ordered in the first place. Can you tell us more about this loophole? So how could those extra drugs be resold? Ms. Ng or Ms. Wu? So without the order paper, I think the most important thing is about the written order. When you buy something, when you order something, you will have this placement of order. So that order, at the receiving end, it might not necessarily have to be the doctor or the nurse placing the order, or the doctor or the nurse being present at the time of the receipt. All right, there is a record as to how many items have been ordered, and by the time when the pharmaceutical manufacturer delivers the products, then the order will be the evidence, and then at the time of the receipt, would that be a very good mechanism so that, all right, the doctor might have placed the order, and then at the time of delivery, the nurse might be present, and then she'll be able to tell that the doctor has ordered these products, and then she'll be able to verify and cross-check what the doctor has ordered, and then whether or not the manufacturer has delivered a wrong drug. So it might not have been the wrong delivery. It's about whether or not you have received the products being ordered by the doctor. And if the records are not comprehensive or complete, then the nurse might have received something different.
The Secretary was talking about the sale of illegal drugs. Now let me supplement. A non-written order can be easily manipulated and made fraudulent. It could be, an order could be placed and delivered to a place without a nurse or doctor present, and it could be signed off. But in fact, the doctor might have not placed such an order. Nobody knows. It might be the case that the doctor is not present. So these types of loopholes can exist. So in the future, to avoid whether delivery was actually made and whether the order was actually placed, a written purchase order makes it easier to trace. So an order was placed and it wasn't delivered, then people can trace that. I think we agree on regulating the pharmaceutical products, but in paragraph 30, the pharmacist has to be present during all times of business operations. You know, you're aware that the general public, when they go to a pharmacy, there's a cross, but the pharmacist isn't present. A registered pharmacist might be taking up shifts in 4 or 5 pharmacies or even 10 pharmacies. So if the pharmacist is not present, then the salesperson is selling the material. This has been discussed a long time. So if this is going to be implemented, if it's not enforced, it's quite ridiculous. To reform, you need 2 directions. You need enforcement. Some pharmacies, they don't have a pharmacist, then they shouldn't be allowed to sell dangerous drugs. They have to be regulated. And some pharmacies have a pharmacist in name, but they just sign their name, but they're not present. And the general public, when they purchase dangerous drugs, they don't need a prescription. This is nothing new. I think the Secretary is aware. The government has tolerated this for many years. So if you have so many specific recommendations, why do we not have strict enforcement? If some pharmacies can still operate without complying, then why aren't their licenses suspended? I think we will see more pharmacists graduating. We are aware that the supply of pharmacists has been increasing over the last decade. So what can you do to enforce the law? Enforcement. I think the second part of the question involves enforcement. Today we're talking about refining the system. Enforcement that hinges upon the enforcement abilities of Department of Health. And already, when I had answered in response to a different question, we have strengthened the drug office of the Department of Health. Currently, the pharmacists, if they aren't present in the registered pharmacy, and as Mr. Kwok said, they cannot sell drugs that need a pharmacist to be present. Under existing law, they are already in breach of the law if they sell it without a pharmacist on site. Some pharmacies only have a pharmacist some part of the time, and they can still register as a pharmacy. In the future, we want to have, if they are a registered pharmacy, they need to have a pharmacist full-time. But to implement that, we need to wait till there are sufficient pharmacists. So we want to have the law in place first, and we can specify a later date for the law to take effect. And during this interim, we have a committee to look at the manpower needs. So when is the when will it take effect? We don't have a specified so this might be 10-20 years later. I think you understand. If we want the law to have this and take effect later, it indicates that we have the determination to do so. Chair, Secretary, could you provide some examples in writing on my question on legal sale of drugs? And I also have a follow-up. The amendment, will it lead to inconvenience to patients? As you said, some drugs are not registered in Hong Kong, and if the patient needs it, they need to make an application to the Department of Health. And I found that some traditional drugs, injections for varicose veins, it's not supplied in Hong Kong. And when you place an order, it takes a month and it can only be used by a specific patient. But a lot of patients can use it. I asked the supplier, these drugs are very safe. Do you have a safer mechanism? Not just one type, but there are many types of drugs like that. The negative vetting mechanism will allow. I'm not talking about that. You're talking about new drugs. I'm talking about traditional drugs. These are very cheap generic drugs. It's just that the usage is not that high in Hong Kong because Hong Kong is too small. They don't register that. I understand what you're. That is a separate issue. It's not. I know it's not in this suggestion. I'm saying, can you handle this problem? Can you arrange, to deal with this? I don't think it can be dealt with in this mechanism. We have simple drugs used for decades. It's very simple to register. It's just that, as you said, the usage is too low. No importer or manufacturer is willing. They don't want to spend that little cost to register. It's not prohibitive. Only new drugs are hard to register. I'll discuss this with you later. Let's handle the deputation request, the hearing request with deputations. We have three choices. We won't hold a hearing. We can hold one in 2014 when the bill is submitted to LegCo, and when we have the legislation, we can deal with it. So, one, there's no need. Two, we can make an arrangement now. And the third option is to wait till the bill arrives. If only one doctor is objecting, then how much time can it waste? 2 or 3 hours tops. But if as the objections are so minimal, we can hear the different views, and there's only one objection, then we can just leave it at that. We're only wasting 2 or 3 hours at the maximum. At least we can demonstrate that our views have been heard. So you want an arrangement now, or do you want to wait till the bill arrives? I would prefer immediate handling of this. No special views. Secretary, let me add, I'm not objecting. I'm just saying it might not be necessary. If Mr. Fong Gong, if he has views on the written a written purchase order, well, the review committee can draw up guidelines. So when they draft the guidelines, they will conduct another round of consultation. That's for your reference. Second, our consultation previously, I can tell you, it was very comprehensive. This is my personal observation. Most of the times, objectors will attend these meetings. Mr. Fong Gong. It's not as narrow as the Secretary described. My suggestion is related to the whole document, not just this issue. I'm referring to manufacturers, retailers, wholesalers, they can all express their views on the difficulties this amendment would present, including the written purchase order. So, Fang Guang Zheng Gok Chu suggests on meeting with deputations. Okay, let's make an arrangement then. December, morning 10th of December. I have a simple question. The amendment, I support that and I understand it. But after the amendment, the regulatory regime in drug manufacturing compared to Switzerland, how do we compare against other countries such as Switzerland? I mentioned that Hong Kong can be a pharmaceutical manufacturing center. So the infrastructure and legal framework, what can the government do to encourage Hong Kong to be a drug manufacturing center? Some of my drug manufacturing friends say that the industry is not expanding. The industry is getting smaller. So what's the update on the situation? Could I add that holding a deputation hearing would affect the legislative timetable? We still have to go to EXCO and so on. Could you answer Mr. Albert Chan's question first? Thank you, Chairman. Regarding the Hong Kong drug manufacturing, this ordinance, it does not. How does the regulatory regime measure up to international standards? Our licensing regime requires manufacturers, when a new facility wants to enter Hong Kong, they need to comply with PICS standard. And
worldwide, there are many pharmaceutical regulatory authorities joining this, including the EU, most countries in the EU, the US, Canada, Australia. So all of them have joined this. And in Asia, Singapore is the first to join the PICS. Malaysia, in other words, they've aligned themselves with this international standard. Japan and Indonesia are both applying to join. So it means that our pharmaceutical companies will comply with international standards. So how do we compare with Switzerland? They are also a member of the PICS. So at present, the US, EU, UK, Canada, Australia, Singapore, Malaysia, and Taiwan, they have already met the PICS standard. And then in Asia, Japan, South Korea are also in the process of applying. And therefore, after we have done this, then we'll be able to meet the international standards. And also, how about the prospect of the local pharmaceutical industry? Well, as for the local pharmaceutical industry, I fully understand the sentiments expressed by Mr. Albert Chan. Yes, there are opportunities because our standards are high, but then on the other hand, there are also constraints. Because as far as Hong Kong is concerned, I think space is another constraint, because we have to meet the GMP requirement on premises. Of course, it's not just about the premises, it's about the flow chart. And when it comes to the flow chart, very often the premises will have to be sufficiently spacious in order to ensure that there will be a better flow chart. That's why in Hong Kong, according to many manufacturers, because of the land premium, they have to invest very heavily before they can meet the GMP standards. How about the industrial areas? Are they able to meet this standard? Well, as far as I am aware, in some of the existing industrial areas, they've already got pharmaceutical companies. So in terms of supporting the pharmaceutical manufacturing industry, what measures are in place and what improvements can be made and what support can be provided to the local pharmaceutical manufacturing industry to have a brighter future? All right, we'll look into that. All right, 10th of December, 10:45. But then the Bureau Director said that that might result in a delay of the tabling of the legislation. Is that right? Yes. Well, the procedures are as follows. We'll come to this panel, and then we will then have to go back to the internal committees of the administration, and then we'll have to go to the EXCO before we can table the legislation. All right, we are talking about 3 weeks later, because after the public hearing, we will have to come back to this panel again. So we will have to come back to this panel after the public hearing. It depends, because do we have to come back to the panel after the public hearing? But then apparently the consensus is that we should have a public hearing. All right, they'll be held on the 10th of December. Okay, let's move on. Again, is a controversial subject. Is about the regulation of beauty or medical beauty procedures. All right, do we have to wait for another team to join us? Yes, Chairman, with your approval, I'll start first while my team will be seated. Chairman, in October last year, the administration set up the Steering Committee on Review of Regulation of Private Healthcare Facilities, and under this steering committee, we have set up 4 working groups. One of the working groups is on differentiation between medical procedures and beauty services, and it focuses on the so-called high-risk medical beauty procedures, and is to review how best we can regulate such medical beauty procedures. To be more precise, we try to step up these so-called beauty procedures, but then in fact they should come under medical procedures purview, and the working group has completed its review and the steering committee has received its report, and on the 1st of November the steering committee approved this report from the working group, and I'm sure you have all received a copy of that report. And the working group examined 35 types of cosmetic procedures and also the health risks involved, and based on scientific evidence and professional advice, 7 recommendations have been made. And the working group proposes that for medical or beauty procedures, as they involve certain risks, they should only be administered by registered medical practitioners or dentists, including those that involve injections and those involving the use of mechanical and chemical exfoliation of the skin below the epidermis, hyperbaric oxygen therapy, and dental bleaching. With regard to body tattooing and piercing, the working group noted that traditionally they have not been regarded as medical procedures, and the risks are well known to the general public already. But then the report has also suggested that if these procedures are done on the more sensitive areas, and if there is a higher risk of bleeding, then they will also have to be carried out very carefully. With regard to the use of energy-emitting devices, the working group recommended that should be dealt with under the new medical device ordinance. Here we'd like to point out that during the past couple of years, a lot of work has been done in reviewing some of these medical devices, because at present medical procedures are growing in number and there are more medical devices being involved, and amongst them many of these medical devices would also emit energy, and to a certain extent that would also pose some risks. And we are now looking into a regulatory regime for medical devices and will be reporting to the panel later. Also, on whether or not we should regulate colon hydrotherapy, as they would also involve the use of medical devices. That's why the working group proposed that that should also be regulated under the new medical device legislation. But then, noting the fact that colon hydrotherapy would pose some risk, for example, there might also be bowel perforation, and the procedure does not necessarily have to involve the use of medical device. That's why it's proposed that we should step up regulation on that. We should also remind the public about the potential risks involved. The administration will be following up on the working group's recommendations, and we will take action as necessary under the medical registration ordinance and dentist registration ordinance. In simple terms, well, for the procedures that we have defined to be such that they should only be carried out by registered medical professionals and dentists, and without the presence or supervision of registered medical practitioners and dentists, if they are carried out, then that could also constitute practicing medicine without a license. That's why we'll be issuing guidelines to the beauty industry so that they would be alerted to this. That is, without medical professionals or dentists, they are not supposed to do this. But then we are also aware that some of these beauty parlors have also referred these procedures to registered medical doctors to carry out the procedure. We do have a lot of concerns about this, and the DFH would also be writing to registered medical practitioners and also dentists that in the course of their practice, if they want to carry out such procedures, they will have to adhere to the relevant code of practice. And the code of practice or code of professional conduct is already there. We are not asking the medical council to insert new requirements in the code, but then at the same time, we'd like to remind doctors that they will have to be aware of this. This is very important, and I'm sure I can also take the opportunity to explain or elaborate a little further, because some of these procedures, according to some reports, the beauty parlor or the beauty industry would promote it to a client who would like to undergo this procedure. All right, they would market this to the client, and after the client has indicated that she would like to accept this, then the beauty parlor would arrange for this client to meet with or to see a doctor, and then the doctor would then administer the procedure on her, and she might not have any idea as to which doctor will be doing this procedure on her, and the doctor might not exactly follow the procedures of treating a patient, because he may not have established this doctor-patient relationship, so much so that a proper diagnosis would be made, and then the patient would be informed of this diagnosis, and proper explanation would be given to the patient as to the pros and cons and also the risks involved in this procedure before the procedure is actually administered on the patient. Yes, it's okay for the doctor to carry out this procedure on the patient, but then he will have to treat this as a proper consultation instead of just seeing the patient with the referral from a beauty parlor. That would not be agree that would not be okay. So we'll be writing to the doctors, reminding them that they will have to adhere to the Code of Professional Conduct. And of course, through APIs, the DOH will also be reminding the public to pay attention to that. And of course, the Consumer Council will also be drafted in to help remind the consumers of the potential risks involved. Thank you. All right. 8 members have raised their hands. If 3 minutes is given to each member, then that would take us 24 minutes. All right. 4 minutes for both questions and answers. I'll read out the names first. Chan Kin Paul, Poon Siu Ping, Vincent Fang, Alice Mack, Helena Wong, and so on. All right. 4 minutes each. 4 minutes, including both questions and answers. All right. We have 9 now. 4 minutes, please. First, Mr. Chan Kin Paul. Thank you, Chairman. Para 6 says that the administration is now reviewing is in a position to draft a new medical device ordinance to introduce a new regulatory framework for the control of the use of energy-emitting devices. But then, according to the beauty industry, there should not be an across-the-board regulation, so much so that all devices would be treated as medical devices. In fact, according to them, some of them are more knowledgeable than doctors in using such devices because doctors do not always use such devices. So how are you going to come up with clear and convincing guidelines on the use of such devices? So how would these devices be defined? And then we will also have to be very careful because people have the impression that the doctors play a dominant role in these steering committees. Would we be giving the impression that the doctors are trying to dominate the interest? Would there be a conflict of interest? So how do you deal with that? And if you really want to regulate it, would you believe that for devices that could only be administered by doctors, can they train those in the beauty industry to use it? So how are you able to convince the public that is a fair recommendation purely in the interest of the consumers instead of just dominating the interests is you're favoring the doctors? Bureau Director, first of all, let me explain. Well, strictly speaking, this is not part of our recommendations.
We have decided to include cosmetic procedures can only be conducted under medical supervision. So in my introduction, I already said that some procedures involving medical equipment we will introduce to Health Services Panel a regulatory regime for medical equipment. We will decide how to regulate. Let me put that first. Since I was asked the question, we are inclined to, if there is difficulty in categorizing, we suggest recruiting an overseas authority to help us define medical equipment. Mr. Chan said if the procedure have to be conducted by a doctor, can the doctor train colleagues to do the procedures? That idea has always been floated. If the doctor feels it is appropriate and if he can supervise and train people, ultimately the liability rests with the doctor. So in the future, if we have medical equipment that can only be operated by doctors, it already allows for that meaning. But today, I'm talking about procedures not involving medical equipment. The authority, the overseas authority you mentioned, is that a doctor? We're not saying overseas doctors. We're saying we can recruit overseas authoritative institutes. the report mentions the how to define medical equipment. I'd like to follow up. Did your study set a timetable for these studies? Because if you are to regulate, it would involve that information. I received some opinion from a cosmetic industry. They accept professional development and regulation. It seems that there hasn't been sufficient communication because this affects their livelihood. So how will you communicate with the cosmetic industry? Do you have any specific arrangements? In regulating medical equipment in the last 2-3 years, the Department of Health has done a lot of work. We are already at the stage where in the first half of next year we can submit a proposal to the panel. I can't give you a timetable because it depends on the response of the panel to our proposal, and then we need to do consultation and legislative work. All I can say is that we forecast that by the first half of next year we will submit our proposal to the committee. Second, in our discussion we understand that the cosmetic industry has pointed out that I need to explain. In our working group we have more doctors. It's because the different cosmetic procedures involve different fields of medicine. We're not going to be biased towards the vociferous groups. We really want to do a better regulatory job, so the working group and the steering committee agree that if the issue deals with medical equipment, especially energy emitting devices, then this will come under the regulatory regime for medical equipment, and there will definitely be another round of consultation. And as I responded to Mr. Chan's question, if the local industry cannot reach a consensus, then we are inclined to find an overseas institute, not individuals. I'm talking about institutes, to provide some opinions. Fong Gong, you understand my position. We had a medical incident last year. We had 1 death and 3 patients with serious injuries. In hindsight, were these the outcome of the beauty parlors or the doctors? We had a doctor making an injection, and according to the secretary, this is the same as the past. A doctor was involved. So I feel the whole incident arose from a doctor. We now have a lot of procedures that you recommend doctors to handle. Well, we need to regulate doctors and prevent the same accident happening again. You said in the next half, in the first half of next year, you will have to delineate medical equipment and cosmetic equipment. That is a good start. why can't you wait till this demarcation between cosmetic and medical equipment? If it is cosmetic equipment, then they can be handled by the cosmetic industry. I think we have a lot of ambiguity now. Tattooing and piercing, you say the risk is understood by the general public, but as far as I know, tattooing is a high-risk activity. There's a lot of bleeding, but you don't regulate that. So I feel if you look at energy-emitting devices, that is more controversial. So can the government wait till medical equipment, cosmetic equipment demarcation before conducting this exercise? I support regulating the cosmetic industry. The cosmetic industry is not bothered by a steering committee or enhancing the profession and instilling more confidence in the public. In fact, it is helpful to the general public. The incident, the doctor, the incident responsibility rested with the doctor. Well, Mr. Fong, after hearing your views, I don't see any difference between your approach and our approach. First of all, you referred to injection procedures. In the incident last year, there was a doctor participating, and on this occasion, there's nobody objecting to procedures that should be done by doctors. It should be done so. Especially regarding doctors, we have to do a lot of work. We have to tell the doctors that they cannot take it as a referral. They have to conduct the diagnosis. They have to keep records. And if you agree, I don't understand why you need to wait. Regarding laser devices, also complying with your suggestions. We're dealing with it after the demarcation between medical and cosmetic equipment. I have a motion. You can submit it? Chairman, I feel this report affects the cosmetic industry participants. We need a hearing, and I hope that on this issue we also arrange a hearing for the cosmetic industry participants. They should tell their story. So I hope you can consider that. Second, I agree with Secretary, as some people said, that the incident, the responsibility lied with the doctor. Why would a cosmetic industry participant, why would they refer a business to a doctor? It's in fact controlled by the investor behind the scenes. We want to regulate the front line, but do you regulate the investors? Do you regulate the businessmen behind the scenes? Even the doctor doing the injection doesn't make a lot of money. but now they are bearing responsibility. And as the Secretary said, this is work done by doctors, then they should regulate the doctors. How? It's not related to the cosmetic industry. So, Secretary, when you want to regulate medical equipment, if it is to be implemented smoothly, then you need more industry representatives. You might feel your report, we want to protect the consumers, but the problem is the doctor has run afoul of the law. So how can we have the industry support you? You need their consultation and participation. So in the future regulation of medical equipment, we need industry participation. Can we have a separate mechanism having the cosmetic procedures regulated by the cosmetic industry? How do you regulate investors? I think there are two parts to this question. First of all, you were referring to the injection done by the doctor. The cosmetic industry found a doctor to do the injection. I haven't heard differing views so far, and when I introduced this paper, the responsibility on doctors' part is definitely more than regulating the cosmetic industry. If you're telling me that the doctors are being recruited to do this work, then my recommendation is no different. I'm just reminding doctors to comply with professional guidelines. The cosmetic industry cannot just refer the patient, and the doctor cannot make an injection without knowing what the injection is. Regarding the investors, if we want to find liability, we don't differentiate between frontline and behind-the-scene investors. You also wants industry participants in the consultation. And when we do medical equipment consultation, we will hear from all parties. Ms. Wang Bigwan, I agree that this consultation should have more cosmetic industry participants. In 7.1a, the administration has medical procedures that can only be conducted by doctors. So these registered doctors, are they GPs or are they specialists? So if a GP undertakes cosmetic surgery, or if GP does dermatological work, that is not appropriate as well. So shouldn't we have a clarification of what you mean by registered doctors? And regarding 7.1a, you refer to injections that should be done by registered doctors. I said you should clarify that. And for injected material, shouldn't you have regulation as well? And the Botox and so on, is that a medication? And what if it's for non-medicated products?
So please answer the question. And also para F on medical devices. Yes, of course, we believe that for high-risk medical devices, they have to be regulated. Of course, we would support that. But then the thing is, if it involves the use of IPL and also laser, which are very commonly used by some of the beauty parlors, and according to the beauty industry, they would treat this as beauty devices. So would that be treated and regulated under the proposed medical devices regulation? So will they all come under medical devices to be regulated in the future? And of course, in beauty parlors and wherever you do it, well, if you try to undergo laser treatment or IPL treatment, of course, we hope that it would be risk-free. But then the thing is, whoever is going to use such devices, they will have to be trained. So does that mean that it can only be done by medical doctors or dermatologists? I think this is not realistic, because we have a shortage of specialists, and if you have to have dermatologists doing the procedure for you every time, it will be very costly. So you will have to take care of the reality that is many people will go to the beauty parlors to receive beauty treatment. So does that mean that for practitioners in the beauty industry, do you have a plan to train them up? So how would that be reviewed? So would you be regulating the entire beauty industry so that for training of the practitioners, and also their qualification framework, and also their code of practice, and also what they can do and what they are not supposed to do? I think that would also enable the entire sector to develop healthily, so that consumers' protection can be afforded, and they would also be subject to proper regulation. So can you tell us whether or not you're going to do this? Bureau Director. Chairman, first of all, on injection procedures, we do not require that to be carried out only by specialists. But then if it involves different procedures, in fact, the Medical Council might be looking into that, and if there is a case before the Medical Council, then the Medical Council will be looking into whether or not that procedure can only be carried out by a generalist or a specialist, because the Medical Council can engage experts to give evidence to determine which procedure can be done by doctors who have had relevant training. And also on certain substances, depending on the nature, in fact, they are actually medication. For example, for Botox A is actually a medicine, and if you are not a doctor and if you administer it, then it's not permitted. And also for the fillers, internationally, they have not been treated as medicine. They are treated as medical devices. So in the future, that will also be covered. Thirdly, for the use of laser or IPLs, in the future, we will be looking into those when we come up with the medical device legislation. Next, Dr. K.K. Kwok. First of all, I believe we will have to regulate the situation. Well, for many years, starting from 1986, this council discussed for the first time on beauty treatments and medical beauty. But then what's disappointing is for so many years, the administration has not come up with effective legislation. I think we have only taken the first step forward on regulating medical beauty. In practice, in many beauty parlors, they are using high energy treatment, and every year the Consumer Council has received many complaints. I don't need to repeat that here. In the past, very often the industry's interest would prevail, and even consumers' interests would become subsidiary. I think that's not going to solve the problem. Now I'm aware that in the second stage, you're going to come up with a legislation on medical devices. I'd like to know the actual timetable for that, because if you delay it by another few years. Last time when we talked about medical devices, I could still recall that that was 6 or 7 years ago, and that was done on a voluntary basis. And initially, when the administration came up with this, and I already told Dr. Lam Peng Yan that is just a waste of time and effort. It's not going to work. Now, in the face of such vested interest, because we do have vested interest groups, and many people would be representing their interests. So how is the administration going to withstand such pressure? And also for medical procedures, you're going to regulate it under the Medical Practitioners Registration Ordinance. If they do not claim themselves to be medical practitioners, and beauty parlors can still undertake such high-risk procedures. So what can be done immediately to achieve immediate effect? And also the administration would also be doing consumer education, because for a long time we have not seen any consumer education telling the public how they can protect themselves against the adverse effects of laser treatment and IPL treatment. So how many more people will have to have permanent damage to the skin before you would do something about it? So is there anything concrete that you're prepared to do? And even for dental bleaching or tooth bleaching, that can only be done by dentists. But then for the use of energy emitting devices, there is no regulation at all. Bureau Director, Chairman, on the issue of timetable, in the first part of next year will be coming to this council with the proposed legislation, and of course that depends on the response from members. We might have to carry out another round of consultation before we have the legislation ready. So by the end of 2014, the legislation will be ready. All right, we can only say that in the first half of 2014, we will come to this council with the proposal. But then what comes next is no longer under my control. I suspect that the panel would also agree that we should conduct another round of public consultation, and that would take another few months. And then after the next round of public consultation, we will have to come back to this panel again before we legislate. Second, you said that for those who do not claim themselves to be doctors, in fact, under the medical registration ordinance, they do not have to claim themselves to be doctors. So long as they are doing something that should have been done by medical doctors, then they are already breaking the law. All right, do you have the figures? Yes, we can supply that later. And also on education and publicity, as you might have been aware, we do have this API. We have already produced this API on beauty treatment. Next, Elizabeth Quat. Thank you, Chairman. Well, for the consumers, they are most concerned about what they should do in order to get safe beauty treatment services, and then the price would be reasonable. And therefore, for beauty parlor operators and beauty practitioners, well, how would the pie be shared? Would that be taken up entirely by the medical doctors and so on? Well, I know many doctors. Sorry, Chairman, I have to declare interest. In my family, there are members who are involved in the beauty industry. I know many doctors, and they say that many doctors have made a lot of money from the beauty or medical beauty services, and therefore they're going to open up such companies on beauty treatment. And I asked them, all right, when you engage in such medical beauty treatments, do you have to take courses on medical beauty treatment? Do you have to get certain qualifications before you can do it? Does it mean that all doctors will be able to do it? For example, I've also consulted some of my friends in the beauty parlors, because they said that for doctors, they might not know where they should inject the Botox, because they might not know which part is the best. And therefore, if they are not able to meet the expectation of the consumers, for example, well, they want to get slim on certain parts, and also they want to get they want to look more pretty in certain areas. They cannot just say that because they are doctors they are able to do it, and then consumers cannot file complaints. So what is the situation going to be like? And according to many doctors, they say that many of the procedures would not be done by them. For example, for some of the energy emitting procedures, they would train up nurses who would do it on their behalf. So the doctors would not be administering them themselves, because it's very time consuming. It's not able to make a lot of money. That's why they'll just train up people to do the job. So for for clinics run by doctors, all right, they will deploy nurses who have been trained by them, and then they can administer the devices. But then how about beauty parlors who have not been supervised by doctors? Why are they not allowed to do it? Or should we take the opportunity to provide professional training to beauty parlors so that they can also get professional qualifications, and if they pass the examination, whether or not they are working for a beauty parlor or they are working for a clinic, they will still be allowed to carry out such professional beauty treatments? Can that be answered? Bureau Director, Ms. Kwok asked about doctors and clinics administering the procedures. I've already spent some time on this. Well, for medical doctors, we have reminded the doctors that they should not view this as a tool. All right, the beauty parlor next door asks you to do it and then you just do it. No, that would not be permitted. At present, if there is a doctor presenting himself or herself to you, if any doctor carries out this procedure, if we want to trace back the responsibility, then we can always take the case to the medical council, because we have already reminded the doctors that as a doctor, you can only do it as a medical doctor, and therefore you will have to make it clear that you are doing it in the capacity of a doctor. You will have to establish this relationship with the patient. You will have to have formal diagnosis. You will have to inform the patient about the risks involved and so on and so forth before you administer the procedure on him or her. And if the doctor is not happy with the result, then the doctor will have to be held liable or responsible. And therefore, whenever it involves injections, if it's a beauty treatment, then it has to be done by a doctor. But then that will have to be done within the professional purview of the doctor. For example, for a diabetic, all right, if there needs to be an injection, the doctor can also teach a nurse or a patient's family member to do it. Because if you look at the international requirement on regulation of doctors, the doctors can also train up his staff to do the job. That's permitted. Next, Mr. Peter Cheung. Thank you, Chairman. Bureau Director, some colleagues have met with some practitioners from the beauty industry, and most of them are SMEs, and some of the medical groups, they might have engaged doctors to do that. We have seen that from many of the cases, but then when we talk to the beauty industry, they agree that there should be regulation, but then apparently once it's regulated, they are going to die, because it's going to be very stringent. Because as some members have said, on the issue of medical devices, apparently most of the devices will be treated as medical devices. In other words, even for devices that would be used by the beauty industry, they are not very powerful, or they might have been treated as beauty treatment devices, and now in Hong Kong they might be classified as medical devices. That's one of their concerns. And number two, if indeed the beauty industry should be regulated, they agree to that, because that would regulate the entire profession. But then the Bureau Director might not be willing to do it, because they are not really under the beauty, under the medical and hygiene industry. So who is to deal with that? All right, under the motion moved by Mr. Vincent Fang, even after the definition is made, it's not going to be under the purview of the Bureau Director. So who is going to do it? Apparently, no particular policy bureau is going to speak on behalf of the beauty industry or to defend their interests. So they are of the view that if indeed beauty devices are going to be regulated, they are more than happy to be subject to such regulation, so that there can be guidelines, and they are prepared to undergo training or even apply for a license. But then if you're not going to do it, and if you just decide that all these procedures can only be administered by doctors, and then some of the doctors would not be prepared to administer such simple medical procedures, then customers or consumers can only go to the beauty parlors for whitening or for simple facials and so on. So it's a dichotic division, so that the beauty parlors can only carry out beauty treatments, and then some of the treatments might fall under the gray areas and cannot be dealt with.
So in the future, when you examine medical equipment, will you communicate with the cosmetic industry? And second, which department is related to the cosmetic industry and can regulate them? Mr. Zhang said we overregulate. I don't think that is the case. The demarcation that I introduced today illustrates that. And I'm referring to injections, and I haven't heard differing views. I haven't heard that whether they are filler material or Botox. The cosmetic industry feels that should be handled by the medical profession. Now, even though it's not the topic today, we will regulate medical cosmetic procedures next year. I am not drawing a line on energy emitting devices because we don't have a standardized international practice. As I said, we will consult an overseas authoritative institute. In this overseas institute, I hope they can help us. And putting aside the interest issue, we can draw a rational demarcation. Which government department? The government has not made a decision to regulate the industry. Mr. Zheng, Fernando Zheng. I just heard the government does not intend to regulate and license the industry. And under Mr. Goh Wing-man, the working group will try to differentiate procedures, some under cosmetic and some under medical category. So I think under the safety principle we would support this measure. But for the cosmetic industry, they are also worried that after regulation, will it affect their industry? They also wish to standardize the industry. There should be licensing. There should be a career ladder for cosmetic therapists. There should be training. And I understand this is not the ambit of Mr. Goh, but in handling this policy and measure, it would affect the cosmetic industry. So I hope Mr. Goh can heed their needs. So should it be Mr. Greg So's ambit? So I hope the government can deal with this issue seriously. The cosmetic industry, they hold a positive attitude and they wish to see the industry regulated and public safety being upheld. From the government's perspective, I'm talking about our current stance. There are a lot of industries. Should all of them be regulated? The government's view has always been to examine the need. We see that some areas of concern, such as the medical cosmetic industry, some procedures might involve risks. So these have to be segregated. So that is the theme of our document. There are also procedures that involve risks, and these involve the energy emitting devices, and when these are controversial, I suggest that when we regulate the medical equipment, we deal with that. If we could isolate these procedures and through regulating the medical equipment, and if that could be regulated under the appropriate guidelines, then we only have to deal with the low-risk procedures. So even the Department of Health, they are meeting with training institutes to help the cosmetic industry. So when the procedures have been segregated, then there should be systematic training for the low-risk procedures to ensure that they can do it safely. That is our current view. Mr. Wang Tinggong. The views illustrated receive my support, but there is a misconception amongst the industry. They feel it is unfair. I think you have deviated in the goals somewhat. The doctor and client receiving the medical procedure, cosmetic procedure, is he a patient or a client? And there are also problems with the beauty parlor. I think that's where the problem really lies. But this gives rise to three problems. The cosmetic service, if there are invasive procedures, there is inherent impact on health, and that gives rise to some contradiction and concern amongst the industry. Point two, the regulation of equipment used in these procedures. Perhaps the cosmetic industry standards are different from the government standards. Then that also leads to concern. And the third point, the qualifications of the service provider. These include the cosmetic practitioners and doctors. How do they define these? If the Secretary could go into greater detail and hear the practitioners' views, listen to their concerns, and there should be a clarification. Professional knowledge and daily practice needs to be clarified, and that would alleviate the cosmetic industry's concerns. The cosmetic industry are also seeking enhancements and regulation. As long as the work is done, differences can be resolved. Of course, consumer interests have to be taken after, have to be taken care of. But we also need to balance the two sides. Well, I agree with Mr. Wong that there is a problem in the interface between doctors and the beauty profession. Just talking about injections, there are problems on two sides. The beauty industry, once they convince a client to receive a certain treatment, if it is an injection treatment, that is a medical procedure. I don't think there's any controversy there. But when they refer the procedure to a doctor, the information provided to the consumer is not transparent, it's not a lot, so the consumer cannot make an informed decision. And the doctor cannot explain the whole procedure to the patient. So our intention is very clear. So medical and cosmetic procedures need to be divided. This is a practical solution, because the medical procedures that are segregated are less controversial. The most controversial are related to energy-emitting devices, and these will be dealt with later, and that would avoid impact on the cosmetic industry. I can stop any time. It's almost time, and I'll extend 15 minutes because I have some questions. I also have to handle some motions and the hearing. Secretary. A lot of members referred to the incident last year. The doctor handled the procedure. It seems that your regulatory differentiation between medical and cosmetic procedures do not handle last year's incident. And you are focusing on regulation, monitoring of the doctors. In fact, the last year's incident involved a young doctor without a lot of experience. He has a connection with a beauty. It could be a real or fraudulent employee-employer relationship. And the beauty parlor boss was also a doctor. In last year's incident, the beauty parlor company, it seems like you are unable to reprimand him, and you are then when a beauty parlor recruits a doctor, or then that's a loophole for advertisement. How do you respond to that? Will you consider regulating companies that claim to provide a medical cosmetic service? How will that negatively impact the consumer? They cannot advertise as such. If a company says they provide medical cosmetic procedure, not the doctor, the company, the employee cannot deal with the employer. If these beauty companies say they are performing medical cosmetic procedures and they refer the case to the doctor, but the doctor takes it like a job. That's why I had to explain. The doctor's responsibility is not just limited to accepting a referral. Well, he is an employer. He needs to bear responsibility as a doctor.
So, as a doctor, he should have explained to the patient the risks and so on and so forth. But then in terms of marketing and promotion of that service, that could become a loophole because the medical council would not have permitted the doctor to do the marketing or promotion. But then that part is done by the employer, and as an employee, there is no way that he could have a control over his employer. Well, once again, let me say this. What's important is that we will have to ensure that the doctor's professional conduct is upheld. So I do not see what you describe will happen, because according to what's reported, according to the feedback, many doctors and even those from the industry, or some representative from the industry, said that they would not declare themselves to be doctors and they would just treat it as a job. All right, I'll ask you a simple question. All right, you're going to regulate those claiming to provide medical beauty services. If you regulate them as well, so what harm can that do to the customers? All right, well, we have to adopt a risk-based approach. That is for the high-risk procedures. If we can distinguish them, and if they can only be undertaken by the doctors, and if doctors have to adhere to the professional conduct, then that would be okay. But then for the use of medical devices next year, we're going to introduce this bill to the panel and we'll explain further as to how we're going to regulate them. All right. Next, Ann Chiang, and then Helena Wong and Alice Mack. No one else, because we have to deal with the motions and the amendments. Yes, Ann Chiang. Thank you, Chairman. Well, for the medical incident that happened, obviously, it's not about whether or not the procedure was carried out by the beauty parlor or a medical doctor. The most important thing is the procedure and also the way it was carried out. Should it be allowed in Hong Kong, or should it be carried out by a medical doctor, or should it be done at a hospital, or whether or not it can only be done by some specialists? So I think that's the crux of the matter. That's why we had the incident. And now you're going to take drastic action in order to distinguish between what can be done by beauty parlors and what has to be done by a doctor. All right, we have to be very careful and cautious in dealing with that, because as a consumer, just now I heard Dr. Koh explain the situation, and apparently he said that in the future some of the procedures could only be done by medical doctors, and the doctor could not say that, all right, he would be doing this as a job, and then right away he can ask a subordinate to carry out the procedure, which is defined as a medical procedure. But Dr. Koh, are you aware of the fact that we do have a shortage of medical doctors in Hong Kong now? And if you require the doctor to go through the procedure of seeing the patient and then come up with a diagnosis, and then he will have to carry out the procedure personally, then I am afraid the procedure will be extremely costly. For a so-called laser or whitening treatment, well, it might cost you more than $10,000 easily. So for an average consumer, it's no longer affordable. So I'm of the view that the crux of the matter is, how come there are so many beauty parlors that can survive? That's because we have an aging population, including women. Well, we do have a growing population of women who are aging, and therefore there is a higher demand for such services. So when we come up with further policy to regulate the industry, we also have to assess the situation. How many practitioners in the beauty industry might be subject to this regulatory regime? How many devices will be subject to regulation, and how many beauty parlors would be affected? Well, 8 out of 10 might be affected. Secondly, we also have to assess how many practitioners will be affected. We also have to assess on the impact on the consumers. All right, if only medical doctors can administer laser treatment, then what will the implications be for the consumers? So we don't want to see a situation whereby only the rich can afford it. That's not what we want to see. There are several questions. I don't know which one to take first. I think one question is very important. If you talk about the incident that happened last year, in fact, that involved whether or not the procedure should have been administered in the first place, because on the face of it, there is no medical evidence to show that the procedure can indeed be effective in making the lady prettier. That's why we have to define what's meant by a medical procedure. You will have to justify it to your patient, and whether or not there is evidence to suggest that it's going to help the patient's condition. All right, in the second round, we have a shortage of time, 2 minutes or 3 minutes at most. We have already overrun. 2 minutes, please. All right, members have asked that only 2 minutes be permitted, both questions and answers. I'd like to follow up on para 3.5 4, you refer to a UK report, and they also talk about non-surgical procedures, and they are also looking into whether or not such procedures should be regulated. That's in paragraph 3.4 in the report. And also 5.4 on differentiation of beauty services and medical treatment. Alright, I have no qualms about A, but then for B, you're proposing that that should be the principle in distinguishing which should be regarded as medical procedure and which should be regarded as beauty treatment. Alright, all procedures that involve the penetration of the body orifices to deliver substances into or remove substances from the body should be regarded as medical procedures. Dr. Koh, have you received any facial treatment? Alright, whether or not it's about collagen or water or some serum. So it will be penetrated into the body through certain devices and so on. If that's the case, then beauty parlors will not be able to carry out such procedures. Alright, for lipo removal, then of course that's another thing. But then how about removal of blackheads and so on? Would that be treated as a medical procedure? Dr. Koh, let me clarify with regard to the body orifices. Alright, in English is orifices. It's not about pores. Pores will not be covered. But then in Chinese it's 天然孔洞. But then it's a medical term. Sometimes it's because that would also give rise to a public that would give rise to public outcry. Alright, only the larger pores would be regulated. Alice Mack. Well, if you ask me about the incident that happened, alright, the practitioner issuing the invoice was innocent, and then the doctor doing the injection was also innocent, and then the culprit should have been the boss of the beauty parlor. And then for many groups, the doctor would not call himself a doctor, but then according to my experience, they've been telling people that they are medical doctors. That's why so many customers would go for them. Alright, the medical doctors might not have adhered to the professional conduct, but then the way they operate such practices is that they would just issue the invoice and they would accept the money payment, and then they would ask the doctor to do it. So I've been saying that if you do not target the tigers, if you do not tackle the problem at source, I'm not suggesting that you have not executed or enforced the guidelines. I'm not suggesting that you should not be regulating the medical devices and so on. But then what's more important? Apparently, Bureau Director, you have not done that at all. Ms. Mack, I think I've already emphasized that just now. Whether or not you're at the front line or whether or not you are operating behind the scene, you will still be held liable and responsible. I cannot just say that well, somebody has hired me to do something illegal and then I would not be held responsible. But I agree with what you said just now. Behind the scene, that person or that guy should also be held responsible. Whether or not we are able to convict him or her, it depends on the level of evidence. I think it's a bit too early for us to say, because the police are still are still doing the investigation. Alright, there are two things that we will have to deal with. We have the motion and also the amendment and also the public hearing proposed by Alice Mack. And then for the wording of the motion and the amendment, we have already made photocopies of that for members. I think the wording is not controversial at all, and if members agree, first thing is about the motion is in line with the agenda and therefore it can be proposed, and if members agree, then there is no need for us to discuss it. So can I just put it to the vote? Is that okay? Yes, Vincent Fang. Chairman, Ms. Helena Wong has moved an amendment. I think her amendment is the same as my original motion. That's why I am prepared to support her amendment, and therefore we do not have to vote twice. I think all we need to do is to vote on the amendment. Alright, I just asked one more question. That's it. Okay, I'll formally put it to you. I don't have to read it out because you've already got the wording. Chairman, in the original motion, well, I've exchanged views with Mr. Vincent Fang. All right. He said that this council or this panel would like to urge the administration. So I was suggesting that we should urge the Food and Health Bureau together with the CEDB, because it involves several things here on the verification or the recognition of the qualification framework, and also the regulation of the beauty industry, and also the future healthy development of the industry, and also the impact on public health. But of course, to save time, Mr. Fang is saying that so long as we all understand what it means, it's okay. All right. Point taken. So can I put it to members? Will those in favor of Ms. Helena Wong's amendment please raise their hands? So we will have to vote separately on the amendment and the motion. All right. Unanimously agreed. No abstention. Next. Will those in favor of the amended motion moved by Mr. Vincent Fang raise their hands? All right. On the public hearing, the Secretariat said that together with the regulation of the pharmaceutical industry from 8:30 to 10:30, there is a time slot available. Would that be too much or too many? Which date? 10th of December. Because initially, when we discussed the regulation of the pharmaceutical industry, we said that there would be a public hearing on the 10th of December at 10:45 to 12:30. So, an earlier time slot on the same day, 8:30 to 10:30. Shall we have another public hearing on the beauty industry? If it's too much, then I can ask the Secretariat to find another time slot, and then we can discuss it later. So you don't want it to be on the same date? Bureau Director, you have a question? Well, you can deal with that first before I ask a question. I need to ask this question because I do respect members and I fully understand members' views in moving the motion, and also a number of questions about the future have been asked. But then I'd just like to remind members that our formal proposal is that after this panel meeting, we will immediately approach the two professions and the guidelines will be issued. So I'd like to know whether members would agree to that or disagree, because what we are talking about is how we are going to regulate the beauty industry in the future, and also the use of medical devices. But then our guidelines, according to our plan, we have already made it clear that we'll be issuing the guidelines shortly. I believe that when we talk about the public hearing, we should wait until after the public hearing. Mr. Wong Ting Kwong, I think procedurally we are talking about two different things. Sorry, please wait, please wait.
If you agree, I extend another 5 minutes. There are two steps. The administration issue guideline, and we hear their industry's opinions on the guidelines, or we can hear the deputation and then the administration can consider whether to take their views on board. I think we should need to hear from the administration first. If they already have a guidelines, they should issue the guidelines for the industry to review first, and then they can amend their guidelines. And so I'd like to add the administration jury. Yes, it's all prepared, and I don't hear significant differences from our current guideline. We are dealing with lasers and so on. If we're on the same page, then we should all be happy. I think it's very unwise to issue the guidelines now. You heard members say that this incident arose from a doctor last year. A lot of equipment are now being handled by doctors. The secretary, should clarify whether it should be handled by a doctor or a qualified beauty therapist. I'm just asking for opinion. The Secretary says, should we issue guidelines first or hear from deputations? Let's review the guidelines. The industry is also... Let's see if the guidelines are in line with expectations. Mr. Fong Gong seems to object. What Mr. Fong Gong said is not a fact. My guidelines did not say which equipment has to be operated by a doctor. I'm only referring to injections, the bleaching of teeth, exfoliation of the epidermis. So, Mr. Fong Gong, you should understand the issue first. That will be regulated in medical equipment. I just want to ask your views. Should the guidelines be issued first, or should we hear from deputations first? Because the Secretary is asking whether we support the guidelines. Can we agree? It's not supporting the guidelines. It's support issuing the guidelines. I don't think the question wasn't supporting issuing the guidelines. We have been criticized for not having a result after a long period of time. Just will members support the government guidelines? If you don't support, then we'll hear from the deputation. What are the guidelines? Have you seen it? It's in the annex. That's it. The annexes, we need to issue it early so everybody can work on the same page. So that's the question. If you support, they will publish it, and then we can arrange for hearing. If you don't want to make a decision, then we'll have a hearing first. Let me ask, there might be different arguments. I'm now asking you, do you support the government guidelines? Do we need to vote? Does anybody ask for a vote? I'm asking you formally now. The Secretary asks, do you support the government guidelines? Please raise your hand if you do so. Six in favor. Those who do not support, any abstentions? So the committee supports the guidelines and will arrange for hearing later on. Any other business? Okay, thank you very much.